afternoon. We are live from the State Health Operations Center. Odom Walker, the Secretary of the Delaware Department of Health and Social Services, and Dr. Karyl Ratay. Thank you. Hear from you, as we know that many people are concerned about the coronavirus disease 2019. Celia would like to know what labs are accredited in Delaware for testing and how many patients have been tested so far.
Yeah, I'll have Dr. Ratay respond to that question, and really appreciate the work that she's doing to lead this response. And thank you for your questions. Please keep sending them in.
Absolutely. So in Delaware, one lab is validated to be able to do the testing, and that's the Delaware, our division's public health laboratory. But there also is LabCorp, which is a commercial lab, which can do the testing now. The testing is actually not done in Delaware, but they are a commercial lab that can send specimen from Delaware out of state to get tested. So that's what's available as far as testing right now. Now, we here in Delaware have tested a total of 19 people. We have had 17 individuals who have been tested and have been tested negative. We have 2 additional individuals, which we consider persons under investigation when there are individuals who have had symptoms and we have concern they might have COVID-19, and they are those tests are currently pending.
Thank you. A follow-up question from Rennie is, what are the requirements to get tested?
So that's a really great question, because that has evolved, and like everything, we continue to evolve. So certainly anybody who has traveled to one of the countries of concern, which includes China, Iran, South Korea, or Italy, as well as Japan, if individuals who have traveled in the last 14 days to one of those countries and have symptoms, they would get tested. If somebody who has been exposed to an individual who has had coronavirus, they would be tested if they have symptoms. But now this is opened wider in the last week. I mean, certainly those who are more severely ill with coronavirus-like symptoms, and there's no other known reason for their illness, would be tested. But other individuals who have symptoms such as fever, cough, and shortness of breath can be tested for coronavirus at this time.
Thank you, Dr. Ratay. We had another question from Jen, who wonders how bad it could be for somebody with multiple sclerosis.
So we are certainly worried about people who have higher risks, and without knowing a little bit more about the medications he's on, it's really hard to say. But certainly people who are over the age of 60, who have chronic conditions, who are on immunosuppressants, which sometimes is the case in multiple sclerosis, could put someone at higher risk.
One of the questions we're also seeing are people hearing the phrase social distancing. Can you describe what social distancing is?
Yeah, it's a great question. Social distancing really is about keeping space or distant from other individuals, and this is especially important to follow up on the previous question for individuals who might be at higher risk for illness. So the recommendation as of the last few days really is for individuals who are over age 50 or individuals with chronic underlying conditions to make sure they keep themselves, at as best as possible, a good, 6 feet or so away from other individuals, that they stay away from sick people, that they stay away from large crowds. So really that's what social distancing is separating yourself from other people. But it also then, social distancing can be, we can cause social distancing by closing things down at times. So if you stop an event from happening or close schools or have people work from home, that helps to support social distancing.
And we know that the way that people get coronavirus right now is from contact with someone who is positive. And so that idea that you would keep some distance between you and others, or avoid large crowds, or avoid the emergency room at a time when someone could be sick around you is really important. And so it is, the social part just means other people. And we're really trying to encourage people who may be at higher risk to try to be cautious right now around those that they may be usually in contact with, whether that's at school or at an emergency room or at a special event.
Thank you. We've also seen some questions asking about schools. So could you speak a little bit about the work that's being done to coordinate with schools, and if there's any discussions of cancellations or anything along those lines?
Yeah, absolutely. So we've had great coordination with the Department of Education and conversations with the superintendents and school nurses, and the guidance of which they are following now is to really look at their infection control plans, which is, how do you prevent infection in your schools, and meaning things like having hand sanitizer available, etc. But also then to think about what would lead to closing school, and if you do need to close school, how can you continue to support learning if a school is closed? So all of our districts across the state are thinking about this and either dusting off their infection control plans or actually putting plans in place specifically for coronavirus, and really thinking about what will be done if a school needs to be closed. Now, we don't know if schools will be closed in Delaware. That could happen for a variety of reasons. If there have been sick individuals in a school, you might close it for a day or so and decontaminate it. But if there's widespread infection in the community, a school could be closed just to help settle down the infection or decrease the spread of the infection.
And as of today, Tuesday, March 10th, in case anyone watches this on a recorded version, no schools are closed. We do want to make sure that people are prepared and could continue to pursue their education, have resources available in the event that something does need to have a closure or cleaning. And that's really why we want people to keep updated information. Make sure you're going to our website, de.gov/coronavirus, to make sure you're checking for any changes that may occur.
What are some steps that the public can take to stay healthy?
That's such a great question. You want to take that one first?
Sure, I get the easy ones. Yes. We really are encouraging, again, the idea of simple hand washing is the best method to avoid illness right now. That means washing with soap and water for a full 30 seconds and making sure that you are using hand sanitizer as possible if you don't have soap and water. We actually know that soap and water is very effective. So, but it is important that we're using the soap and using the water and scrubbing. So for a full 30 seconds, you can sing happy birthday, you can sing a song that you like, but I think that is really important, and reminding everyone, if you touch your eyes, nose, or face, that can be an easy way to get sick. And so these are things that we do to prevent the common cold, to prevent flu. It's also really important to think about what we're doing to greet people, and whether that's instead of handshaking or hugging, putting your hand over your heart or giving a nod or doing other things right now can really keep you healthy as well. What I missed? I'm sure I missed a couple ideas too.
Well, I was just thinking about, we just got off a phone call with Senator Carper and Senator Coons and Representative Blunt Rochester, and they were suggesting that we think about, how do we change the culture around shaking hands, right? Because that's a way to spread it. If I have virus on my hand and I shake Dr. Walker's hand and then she touches her eyes, that's an easy way to infect yourself. The elbow bump is a really great way to, you're not going to spread virus bumping elbows, right? So how do we change the culture around that? Because we tend to shake hands a lot, and even hugging, if there's close contact there can spread. So, it's a good time right now to be mindful about, do we really need to shake hands? Maybe we shouldn't let ourselves be offended if somebody doesn't want to shake our hand. But also, very importantly, just do your best to stay away from sick people. And if you are sick, don't go out in public. Please stay home.
So to wrap up, what are some resources that are available for people with further questions?
Yeah, absolutely.
So we definitely want everyone to know that there is a hotline, a call center that you can reach out to someone who can talk you through your questions. The phone number is 1-866-408-1899. You can also go to the website. It has the information there, as well as flyers and resources like frequently asked questions. That will continue to change and evolve. So please do visit the website, de.gov/coronavirus. And there are specialized guidance from the Division of Public Health, thank you, Dr. Ratay, about what schools can do, about how to get information about specific questions depending on where you work and where you live.
And we want to hear from the viewers too, if there are other things that they feel they need from us to help them keep the people they work with or care for healthy.
Great. Thank you so much, Dr. Walker and Dr. Ratay, for your time. We appreciate it.
Thank
From
you.
the State Health Operations Center.